When you hear of a family who loses a child to suicide, one of the first things people say, well, why didn't they get him help? You know, and it's like, well, but we did, and we tried.
Appointment after appointment looking for help for their son, Jake.
Unfortunately, it was just a couple weeks after that appointment that we lost him.
Ben and Denise Denslow look back at a time when they were desperate.
It's the second time he's been hospitalized in 2.5 months. He's, you know, how do you determine that somebody is no longer suicidal in 5 days?
And that roadblock is what Dr. Richard Silver is trying to clear out.
But the bottom line is, if there's no place that they can go at all, or they're there for a very short time and they need it longer, we need to advocate for those folks.
The need in the community is so great. Take a look at this. In just 10 years, a state report shows a nearly 200% increase in the number of adolescents visiting the ER with suicidal ideation.
We have patients who are really kind of stuck in our emergency rooms, stuck in our hospitals, who have reached a point where they're stable enough to get the care they need in the proper milieu, but they're not safe enough to go home.
The new facility will be not only for mental crisis.
And partials, where someone comes for the whole day as if they were in the hospital, but they sleep at home. And these are transition programs for those that are not ready just to go home.
For the Denslows, the facility, a sign of hope.
You know, the hospital being built, let's hope this is the first of many.
Yes.
You know, you can't drive 5 miles down the street without seeing a regular hospital for physical care. Mental health needs to be involved just as much.
Hoping that mental health is making its way to being just as important as physical. Carla Navarrete, ABC 15, Arizona.